Okay, my name is Ken. I'm an optometrist. Alright. Glaucoma, basically we need to look at the optic nerve head, which is at the retina back part of the eye. So some of us, we have fundus camera. So it's a camera that you can take the picture of the retina to look at the optic nerve head. There are many other tests that we need to do. We need to check for the family history, if their parents or their next of kin has got glaucoma. And we can also use OCT machine, check for visual field. So there are a couple of tests because glaucoma is a combination of different conditions and pathology. We will be able to see and detect diabetes at the retina because the retina is the only tissue surface where there is no skin or any muscles covering it. When they have diabetes, you literally see like blood vessels leaking, and these blood vessels can actually cause edema, swelling, and when new blood vessels have to come in and they die off, it can cause detachment. Glaucoma, diabetes. Of course, when you have diabetes, it's a three highs again, your cholesterol level, your high blood pressure. All these problems can affect your eye and they are hereditary. Macular degeneration, yes and no. Again, it's always good to know about their history so that we'll be able to diagnose, but glaucoma and diabetes mainly. There are a lot of steps that we have to take. Number one is the history to find out what's wrong with you, to find out what are the symptoms that you feel, your family history, your personal health. And then we use different machine that checks the front part of the eye. It's like a standing microscope. It's a magnifier that can check for cataract. That's for the front part of the eye, dry eyes, contact lens, your cornea. Yep. And then we use another machine to check the back part of the eye. Sometimes it's a direct scope. That means we look straight ahead to the back part of the eye. Sometimes it can be an imaging. That means we take picture of the retina to look at the optic nerve and the macula. So right in the middle, we also have to check for eye pressure because the eye pressure does tell a lot about whether one has got glaucoma or not. So if you have cataract and you don't go for your removal surgery, and it can actually cause glaucoma, secondary glaucoma. So these are things that the public need to know. If you have cataract, you have to go for it. And the fortunate thing is that cataract is reversible. Meaning if you have cataract, you remove it, tada, you can see. But you know, like again, I keep talking about diabetic retinopathy and glaucoma. These are dangerous because it's irreversible. Meaning, if your vision is affected by it, and even if you go for laser, if you have bleeding at the eye to stop the bleeding, or if you have glaucoma and the nerve fiber layer, that means your visual field is affected. And just by going for the surgery or even with all the treatment, the vision doesn't come back. So if you have cataract, go for it. It's a must. Yeah.